Good afternoon, everybody. On behalf of Southern Illinois University School of Medicine's Department of Population Science and Policy, the University of Illinois at Chicago School of Public Health, the SIU Medicine Center for Rural Health and Social Service Development, and the SIU Paul Simon Public Policy Institute, I want to welcome you to our latest Rural Health Summit webinar, COVID-19 and Children's Growth and Development. My name is Samir Vora, and I have the pleasure of moderating this incredible session this afternoon, where we're going to be talking to a diverse set of leaders across the state of Illinois and in rural Illinois in particular, in thinking about ways that the pandemic has affected children's growth and development, and thinking about solutions and ways that we can build brighter futures for children all across our state. For those that have been with us throughout our Rural Health Summit webinar series, you know that this is the fifth of 9 webinars brought to you by the partners I mentioned that make up the Illinois Rural Health Summit Planning Committee. We've had the pleasure of having 4 webinars up to this point around caring for an aging rural population, mental health, public health systems, and nutrition and fitness. Each of these webinars, including this one on children's growth and development, was preceded with a policy brief that talked about the challenges of our rural communities, the innovations that are happening now, and policy solutions moving forward. For today, we're going to really talk about the challenges that are happening, the innovations for our children and their families. And as I mentioned, we have an incredible panel of leaders throughout the state and want to take an opportunity to introduce them to you now. First is Dr. Lori James Gross. She is the superintendent of Unity Point School District, number 140 in Southern Illinois. Unity Point is a pre-K through 8th grade district of approximately 625 students, serving an international population representing over 16 languages. She began her teaching career as a high school history and government teacher in Texas in the inner city San Antonio Independent School District. Dr. James Gross has spent the last 25 years in administration, including the past 19 as a superintendent. She also serves as an instructor in the Educational Administration and Higher Education Department at Southern Illinois University. Dr. James Gross graduated from Indiana University with a bachelor's degree in secondary education. She also received a master's in educational leadership from the University of Texas at San Antonio and a PhD from Southern Illinois University, Carbondale in educational administration. Thanks so much for joining us today, Dr. James Gross. Next is Chichi Oku, who joined EverThrive Illinois as executive director in September 2019 with over 10 years of experience in vision casting, partnership building, and fundraising experience. EverThrive Illinois is a statewide nonprofit committed to advancing health equity for women, children, and families by weaving together policy action, community engagement, and strategic partnerships. Before joining EverThrive Illinois, Ms. Oku served as senior advisor at World Vision USA, a global humanitarian organization helping children, families, and their communities overcome poverty and injustice. As a nonprofit leader, Ms. Oku has developed diversity, equity, and inclusion strategies for various nonprofit organizations and facilitated workshops focusing on race conversations, social justice, and community mobilization. Ms. Oku received both her master's in public health and her bachelor's in social psychology from the University of Alabama, Birmingham. Thank you so much for joining us. Next is Dr. Kathy Swafford, who is a pediatrician and child protection specialist. She received her undergraduate degree from West Georgia College in Carrollton and her medical degree from the Medical College of Georgia in Augusta. She is an assistant professor of pediatrics and the director of Southern Illinois University's Children's Medical and Mental Health Resource Network, a medical resource for abused children and professionals in Southern Illinois. Dr. Swafford is board certified in child abuse pediatrics by the American Board of Pediatrics. She's also board certified in pediatrics and a member of the American Academy of Pediatrics and the Illinois chapter of the AAP. She is also a member of the Ray E. Helford Society, a society for child abuse medical professionals. Thanks so much for joining us, Dr. Swafford. And next we have Miss Lori Longville, who got kicked out for the moment, so we can appropriately welcome her when she returns. Ms. Longville has over 40 years of experience in the field of early care and education, including 31 years as the director of the Child Care Resource and Referral at John A. Logan College, which serves the 15 southernmost counties in Illinois. In her current role as the chairperson of the Southern Illinois Coalition for Children and Families, Ms. Longville is actively engaging community members in systems development efforts designed to improve outcomes for young children and their families. Ms. Longville has served on numerous boards and advisory councils, including the state's Child Care Advisory Council, the DCFS Licensing Advisory Committee, Secretary of the Governing Board of the National Association for the Education of Young Children, and most recently, the Governor's Early Childhood Funding Commission. So this is our incredible panel before you. And part of it, just to understand where we're coming from with these webinars, that in late 2020, the Rural Health Summit Planning Committee convened stakeholders for 11 discussion forums to better understand and address the COVID-19 pandemic in rural Illinois. 80 leaders from 55 organizations in fields such as public health, healthcare, academia, industry, and government met virtually to discuss how the pandemic is creating new challenges and fostering innovation. Discussion forum participants were invited to additional sessions to identify common challenges and synthesize, most importantly, impactful solutions. The information, anecdotes, and issues raised in the brief come from these conversations. And as we mentioned, each of these webinars are preceded by policy briefs that discuss the things in our webinars in deep detail. We started with a overarching executive summary of the challenges that were posed in all of these discussion forums in March 2021, titled Building a Healthier Rural Illinois, Understanding and Addressing the Challenges of COVID-19. Then subsequently, each of the 4 briefs that have followed, and this 5th one on children's growth and development, go deeper into these specific issues, acknowledging the challenges and the pre-existing conditions before the pandemic, the ways in which the pandemic made some of those issues more challenging, but also highlighted some of the incredible work happening by leaders like those on this panel today on ways to combat those challenges and really improve the health of their communities. Then those briefs have policy recommendations that we'll dive deeper into in this session as well, so we can chart and build a blueprint for future action across all of our Illinois communities. So we'll take off the PowerPoint and let's get started with our panel. So the first question, and I would love some comment from all of you. And we'll start with you, Dr. Swafford. Can you give us a little bit of, from your perspective as a pediatrician, a child abuse specialist, in what ways were those children and families in deep Southern Illinois challenged before the pandemic? And what have you seen since the pandemic started? How have some of those issues and challenges worsened?
I think there are several areas that were present before that have significantly worsened. Probably the first one I would mention is childcare. In my county, we have one remaining childcare provider that's a licensed childcare. So very little resource for parents who are trying to work. Over the time of the pandemic, meeting the needs of the children who were remote learning, we found a lot of issues around that. I probably hear every day from parents and children who come into the office about the difficulties of trying to do remote school and the parents who feel unprepared. Many of my families may not have internet access, so their learning was papers being sent home, which was not very productive. As far as physical health or access to health care, I don't think that, as far as I'm aware, none of us closed our practices. We all stayed open. Most of us have also expanded to offer an option for telehealth for families who did not feel that they could come into the office. And fortunately, we've been able to continue to offer that. So at least in my practice, I don't feel that we have gotten too far behind in vaccinations, which has been a real concern. I do know that there are some that are lagging, but not the high percentage we were worried about.
Thanks, Dr. Swafford. And, through our research, I think one of the shocking statistics is that 55% of children under the age of 5 in rural areas live in a child care desert. And that's defined as a zip code with at least 30 children under the age of 5 with either no child care centers or more than 3 times as many children as spaces in child care centers. And more than 1.3 million rural Illinoisans live in that child care desert. And so, thanks for bringing that comment up. And then just the incredible challenges with schools. And Dr. James Gross, as you have had to manage that really now for 3 school years, as our latest school year has come up, please describe for us, I know that there have been many, but some of the ways and the challenges that have come in really getting school up and running and how those have affected our kids and their families.
So several things. First, let me just touch on kind of following up with what Dr. Swafford had indicated. Connectivity has been a huge issue for our families pre-pandemic, and then obviously it was magnified in the middle of this pandemic. So when you talk about remote learning, obviously that was something that was huge early on in terms of being able to provide equitable services to our students within that particular setting. So when you talk about equity, for example, her example regarding childcare, just equity for students in a rural area looks sometimes very different than what it does, for example, in the suburbs of Chicago. So we really saw that as a difficulty trying to address our students as they were in those remote settings. And so when it came finally to making some decisions around what we needed to do to get the 21-22 school year up and running, a lot of our work really focused on mitigating a virus. And so very much, pivoting from what my area of expertise is, which is education, to more about how do we maintain and create a very safe and healthy environment to invite kids back to, mainly because some of the things that we were seeing and have seen just from the pandemic, the isolation that was created for our students within this area, the disconnect from their peers, their general location of where they are living, and the inability to interact with their peers. Again, talking about the internet connectivity, even with providing hotspots and access to technology, again, because of the location, there was instability in that level of connection. Students really struggling with food insecurity, emotional concerns. And so what we've really had to address beyond just our mitigation efforts, and I can talk about those here in a little bit, was the issues that were brought on a much more emotional and psychological level coming into the district. So again, that feeling of isolation from their peers, which also led to anxiety of actually even returning to school. That was very noticeable for many of our students. Struggling to interact with their peers in a socially appropriate manner has been, it's almost been like kind of reteaching that aspect of it. Rebuilding stamina, school stamina, being able to manage the length of the day, being able to manage the mental capacity of the day, you know, engaging with multiple adults. They hadn't done so in a very long period of time. And then, of course, all of their peers. I mean, we hadn't had over 600 people in this building for 18 months. So we all had to kind of learn how to work with one another all over again. And then because this was something I don't think we really expected to manifest the way that it did, but because families were in such of a survival mode over the last 18 months, many of our older students, our junior high students, were kind of left to their own devices as parents were dealing with their younger siblings. And so they were engaging in some developmentally inappropriate type of activities. And what we've seen transferring into the school setting, you know, it's really created some behavioral concerns and some incidents that we typically don't experience. So, for example, issues of vandalism, very graphic graffiti, vaping, use of marijuana on site, leaving the site. Just those types of things that we didn't typically see that level of kind of independence at a junior high level. And when we go to have the conversations with them, many of their comments are, well, I've been making decisions myself for the last 18 months, and now all of a sudden you want me to adhere to your rules, regulations, etc. So really trying to kind of reset within our setting and really help students understand what's age appropriate, what's expected of them, and then most importantly, just to make sure that they feel safe and that they are healthy within this environment.
Thanks so much for sharing those challenges. And I think, as a pediatric provider myself, trying to some degree have some grace and understanding on the incredible challenges that our families faced. But then how do you feel like you have to fast forward to get them to a certain point without acknowledging that the pandemic, we've thought about it primarily in terms of our physical health, of course, but the other sort of effects. And, some of these sort of statistics that, are pretty shocking, that compared to 2019, the proportion of mental health related visits for children ages 5 to 11 and 12 to 17 increased 24% and 31% respectively across the country. And even more concerning is that 75% of 18 to 24-year-olds had reported at least one adverse mental or behavioral health and condition, and 1 in 4 in that age group had seriously considered suicide. And although we don't have those statistics, I'm sure in that 12 to 17 group, that number is pretty significant as well. Ms. Oku, thinking about this statewide through EverThrive's lens and your personal work, one of the big things that had come up very much so in our discussion forums throughout the end of 2020 and then still continues now is when we think about disparities. I think there's often a conversation that these are rural disparities, these are disparities in the cities, without having sort of a big picture conversation that maybe the way they look are a little bit different. And maybe the culture in which they're constituted are a little bit different. But the disparities are huge in each of those areas. Could you speak to that in ways that, as you guys have thought about these issues statewide, some of the ways and connections between those things all across the state?
Yeah, I completely agree. I mean, I think it's, as I was listening to my colleagues talk about some of the issues that they've seen, I mean, we're seeing these, statewide. We're realizing that, access to high-speed internet is really, it should be available to everyone, and not just because you can pay for that or not, because that's connected to your education, and now increasingly so, it's connected to your ability to get consistent healthcare and access healthcare if you might be in a space where that is not available. And often we think about access in terms of transportation, which is also an issue, but we see those things in urban areas and in rural areas. And so having access means not just that it's down the street from you, but if you need to find a provider, can you do that? If you need to make an appointment and feel safe about doing that, you feel safer doing that through telehealth, can you do that? So some of those are definitely statewide issues that we're really, continuing to advocate for. In addition to, what I think we're really facing right now is a mental health crisis among our children, and that is also statewide. That is it, and there are lots of groups are convening to really talk about, okay, how do we tackle this? How do we prevent this? How do we address this? But we're seeing that data regardless of where you live, and so we know that there's got to be a coordinated effort in ensuring that all children have access to mental health providers who are trained to treat children, and making sure that it's affordable, and that we have schools have the resources that they need to be able to address these things. Because while the pandemic definitely uncovered a lot, really exposed a lot of the health disparities we've been talking about for years, I don't see that going away anytime soon, and it's only getting worse as time goes on, and the longer that we kind of exist in this pandemic. And so a lot of these things we're seeing statewide, and I think really require a statewide approach. Obviously, those approaches look different whether or not you're in rural areas or urban areas, but we have to really bring these issues to the attention of everyone and say, okay, how do we then begin to address these disparities that have been exacerbated by the pandemic?
Yeah, that's great. And I'm thinking through and some of the common links across all of our sessions have been this idea of, we call them the 5Ds. The disadvantage that we see in our rural communities across the state, the deserts of, we talk about childcare service deserts, the desert of broadband, the deserts of providers. And Ms. Oko, to your point, 81 of Illinois' 102 counties lack a child or adolescent psychiatrist. And Dr. Swafford, even they lack a pediatrician, right? And would love for you to kind of, talk about some of just that in and itself, is that for many who might be part of this webinar, and even if you're where I am in Springfield, where a pediatrician is a pretty common thing, how do children get, the health care that they need, and how, as you guys maintained open, what were ways that telehealth as one sort of strategy was used? Could the necessary infrastructure be created to use that effectively?
Having been down here for 30 years, I will say that the availability of a pediatrician has improved over time. When I came, I had patients who I initially started in Carbondale, and I had patients who would come from as far away as Chester, and patients who would come from the other direction from places like Carmi, and it would be an hour and a half drive to come see the pediatrician. We've now put pediatricians in many other communities, and that, I think, has improved things. Many of our children in Southern Illinois receive their health care from federally qualified health centers. And we have some excellent federally qualified health centers here. I worked in one for several years before opening a practice in the same community. Most of our federally qualified health centers do have pediatrics as a specialty with pediatricians. And if they don't, then they usually have family medicine, and they also see children. So I think the availability of providers has significantly improved. Telehealth, I think, primarily was used, I would say, for acute care. They had a cold, they thought they, might need an antibiotic for some problem or a skin condition. And many of those kinds of things, I think we can feel pretty comfortable managing by telehealth. I felt well care was very difficult to do by telehealth because a lot of well care is assessing development by seeing the child and the parent interact in your office, and it's hard to get that over the computer screen. I think that was an area that I have a lot of concerns because the agencies that provided developmental services were not going to the homes and had no in-person interaction. And so I think one of the biggest areas that I've seen deterioration, if you want to use that term, in the status of my children has been through developmental services. And that, of course, is going to significantly impact as they move into the school system. We have seen some improvement in, we've significantly expanded the early childhood Head Start program in our southern 7 counties because that's where we've needed services. And so that has been, I think, a big help. But again, for most of the pandemic time, they have not been going to the homes. They have been, again, by telehealth, trying to provide those services. So I think, in general, telehealth has expanded the overall availability of pediatric care. And I think it will stay as near as we can tell. But I think that interpersonal interaction that you can get with an in-office visit has been something that's been less able to be met through that telehealth service.
Yeah, no, that makes perfect sense. And I think, as we kind of, broaden out those, 5 Ds of how do we, the third one we often mention is disconnection, right? The disconnection in terms of the broadband, but also, well, how do you understand how to work in these platforms, right? And sometimes it just things happen, and we're still working on getting Miss Longville back, but just part of the things that we continue to see, challenges that come up in the way that we interact and intersect with each other, and then sometimes our services just don't connect in the way that they need to. And that's what causes the 4th D, those disparities. And then, so how do we push the right kind of developmental strategies? And one of those things that we're also challenged, and I would love for Dr. James Gross and Ms. Oku to comment on this from each of their perspectives, is that, we spend this talking about our children and their growth and development, but so much of this is also about the people who take care of those children. Their parents, but also the teachers in the schools, the child workers in general across the state. And maybe start with you, Dr. James Gross. You mentioned just people coming back in the building. How did those teachers, the other administrators, the other people taking care of the kids in your school district, how are they doing? And how, in things that you guys have thought of to sort of help them as they take care of our kids?
Well, I think a couple of things. I think the most important thing that we did to really, the initial thought was to help take care of our students and our parents. But ultimately, the process that we went through really also assisted in really supporting just the work with here in the building and kind of lowering the temperature just a little bit in terms of not only feelings of safety, but how are we going to accomplish this? That was frankly everyone's greatest concern, was just all of the responsibility that came with trying to mitigate a virus, trying to make sure that we are continuing to educate kids. And then within those two pieces, really understanding the fact that everyone is experiencing some level of crisis within this larger, worldwide pandemic. And so we were already engaging in utilizing success planning for our students. And one of the things that, if there were a silver lining within the pandemic, it allowed us the time early on last year, or with the beginning of the 2021 school year, for all of our employees, that included teachers, bus drivers, whomever, to engage in that success planning process and meet with all of our parents and our students, all with the exception of one family, and to take nearly an hour to an hour and a half to have discussions about what the needs were, not only from the family perspective, but also what that teacher or what those individuals were experiencing here within the classroom. And so or in the building, what it allowed for, the process allowed for there to be a true partnership between parents and students and teachers and aides and bus drivers and cooks and whomever, to really talk about what it was going to be like to essentially be that child's co-educator in every facet: how we feed them, how we transport them, how we make sure that they're getting to the appropriate childcare if they have it. I mean, all of those types of things were shared within that process. And what happened from creating that initial plan for each student is that I think the parent felt a little bit of relief, in the sense that they knew that they were in this together with someone, and that we understood that them taking on the role as remote teacher was going to be extremely difficult for them, just as much as us taking on the role of caregiver was going to be very, very difficult. And so I am grateful that we had the ability to do that, and we're continuing that work, because what it allowed for was for our parents and our school employees to be in constant conversation with one another. Through whether it be phone, and now they were Zooming one another, and now when parents were contacting and talking to us as administrators, they were referencing that ISSP plan and understanding what needed to take place to help everyone. So that was huge for us in helping to take care of each other.
Ms. Oku, just sort of building on that, right? And I think part of what I have always admired about, EverThrive throughout its history is, focused really on, health improvement, health equity for women and children and their families. But really at the core is about community engagement and partnerships. And just the idea of how many partnerships are needed to take care of a child and their families. And to all the conversations, and I know it's a big question, but like how have those strategic partnerships been beneficial at a time of just such disconnection with the pandemic?
Yeah, it's been huge. I think, obviously being a parent is probably one of the toughest jobs you can take on. And, often in our society, we look at that as like, well, that's your job to, make sure that your children are safe. But, when we entered this pandemic, we were really thinking about, okay, there's so much information coming at us from all different kinds of directions. But our role as EverThrive was to say, how can we make sure that we're providing information for parents and families to make the best decision with the information we have today, which was changing, by the hour, it felt like, but making sure that they had, clear information about how they can make the best decisions for their families. And for us, we partner with a number of social service providers, people who are in touch with parents and families on the ground who are providing support. And so in addition to our communication with our the members of our family councils and things like that, we really worked with social service providers to help, answer their questions, to provide clear information, as the pandemic, continued, really listening to the questions that they had, what were the concerns they were hearing from the clients they were seeing, and then providing some clear information and training on how to support families during that time. And we continue to do that, really, and continuing to advocate for things like we want to make sure that parents are able to take off of work when they need to so that they can take care of their families, that they have the flexibility that they need to when they're teaching their kids at home or they don't have childcare, that they shouldn't be penalized for those things, and really trying to speak to some of those needs and address what we can in the moment, but then also taking that to look at larger policies to ensure that we are taking care of parents and supporting them, because this shouldn't be a single person activity. This really is about how does a community as a whole rise up to support families and ensure that they have the resources that they need to thrive. And so our partnerships, especially with social service providers around the state, have really been crucial in this time in helping us understand what the needs are, but then also being able to provide the resources that they need to be able to support the families that they see on a daily basis.
Thank you. And so with that as kind of our foundation, wanted to sort of bring up these 3 policy recommendations and ways that we can begin acting now and into the future to build brighter futures for our children. One of the statistics that we did not share was that in a 2018 study by the Illinois State Board of Education, 75% of Illinois children were not prepared for kindergarten. And so one of these key strategies of how do we build the capacity in rural Illinois, and I think part of this is true throughout the state, to provide children with the academic, social, and emotional skills necessary to be prepared for kindergarten. And part of that isn't just, we need money, but we also need the training, we need the workforce, we need an understanding of what that even means to be prepared for kindergarten, which I think is part of the challenge that kind of goes through. And the governor's office has invested a huge amount of COVID relief dollars to thinking about strategies around kindergarten readiness. And it feels like it's the time to act to create those skills now. Number 2, we need to increase funding and technical assistance opportunities for rural schools to provide quality, affordable, and comprehensive health care to children. In many of our conversations throughout this webinar series, the importance of schools in our rural communities to be an anchor organization has been a recurring theme. So how can we take advantage of federal mechanisms around school-based health centers to help address the needs of students now, but also into the future? And finally, in our conversations around disconnection and the truth of so many different individuals thinking about children and families, how do we encourage childhood service sectors to provide integrated, personalized, and comprehensive services to children and families in rural communities? And so as we go to our panelists to sort of dive deeper on some of the innovative things happening right now in pushing forward some of those policy recommendations, I want to remind all of our participants that we'd also love to be able to take your questions. So please feel free to leave a message in the chat or share a question for our panelists in the Q&A. So these are huge, big policy recommendations, right? I think one of the things that is really pushing our work and pushing these conversations is that what better time than now with the federal investment, the state investment, for us to think big on actually putting big solutions into place. And one of these things I think comes to this sort of capacity. We spent, some time talking about child care centers. When we say build capacity, I think we're talking about space, we're talking about training, we're talking about understanding sort of the need and challenges. But how do we make that work? We talked about all those childcare deserts that are there now. And some of it is, well, we can use technology to help mitigate certain challenges, certain deserts, but we can't in terms of taking care of our kids, right? You need somebody physically there to take care of a child. And so in your experiences, I think, Dr. Swafford, you talked about sort of the importance of developmental outcomes. Dr. James Gross, what are things that you two have seen in ways that some of those issues are being done right now to build capacity to help get kids prepared for kindergarten?
Go ahead, Dr. Swafford. I'll throw it to you first.
Well, I would certainly say training is an issue. For example, not to beat up on any particular group, Shawnee Community College is our college here in Union County and several other counties. And I think it's been maybe 5 years, maybe less. They closed their early childhood program. So they no longer train anyone who can then come out and go into our Head Start program or go into our child care facilities. So then people who are interested are left to go farther away for education. And as we know in the rural areas, once many of them get away, they don't return. So of the one child care facility here in our county, they've been advertising for help and cannot find help. So they've had to decrease the number of students that they can take in the after school program in an effort to continue to provide for the younger children. So I think that's an area that needs bolstering encouragement. Now, I'll show a positive thing. Shawnee Community College has just recently gone into a partnership with Rural Health, which is our federally qualified health center, and are training medical assistants who are going to intern at the federally qualified health center. So then when they finish the program, they will have some clinical skills and potentially employment opportunities to stay in the community. So there are some partnerships, I think, developing, but that education, especially for childcare, I think is one that we still don't have in place at this point. The federally qualified health centers in Southern Illinois are the primary ones who have been involved with school-based health clinics as well. And so we do have a few of those, but certainly not enough. We transiently had one here in Union County at the high school, and that has been closed now for a few years, unfortunately. And I am not at the health center or at the federally qualified facility to know what all of the reasons were that they felt it was not a sustainable project. But to get someone in the school to provide that health education component as well as health care. We have seen an improvement in the coverage of school nurses in Southern Illinois. Again, when I came 30 years ago, almost none of the schools had school-based nurses. And now pretty much everyone does. It may not be full-time, but there is someone there to provide some supervision of medications and different things that are real important. So I think there's been improvement over time, but I would agree with what's in the chat that we're not as well coordinated as we probably need to be. And so I think that is something I'd like to see come out of some of these additional dollars, is to have us put together a stronger coalition of agencies or areas of interest to support children and families to look at how can we better work together to do some of these things.
And Ms. Longville wanted to just on this point, although those technical issues are still there, still participating in the dialogue, that to encourage, those in rural spaces to engage in councils and collaborations around this idea. That there is money being pushed by the governor's office, and this is a unique chance for rural areas and families to have a stronger voice in how that capacity can get built, creating those partnerships. And the initial focus is really around connecting children to high quality early learning programs, being able to identify those and then get individuals into those spaces. So I don't know if you have anything to add, Dr. James Gross, but I'm also happy to move on.
I think just when you talk about the high quality early learning experiences, I think birth to 3 programs are an area in which there needs to be significant focus. I mean, that's always been an issue, even pre-pandemic, but coming out of the pandemic, when you talk about really assisting families with, what is developmentally appropriate and what needs to be happening at those particular levels is extremely important. I would echo staffing concerns, as we look to put these programs together, whether it be birth to 3, pre-kindergarten, and frankly, any of our K-12, classroom settings, finding educators, teachers, the teacher shortage, recruitment, retainment, all of those are significant issues when you start talking about trying to prepare kids to transition into each and every grade level. And then also talking about a collaborative effort in terms of designing, for example, maybe a children's cabinet that looks specifically at drawing upon all of the various partnerships and services that are available so that we can be more coordinated in our efforts, more aligned in how we approach what it looks like for our youngest learners and in terms of how they, move from pre-kindergarten into kindergarten. And then the last thing I would indicate was just that we have really high quality pre-kindergarten programs happening all across the state. But one of, I think, my frustrations and general frustrations is that our pre-kindergarten programming and the data that we collect from pre-kindergarten, it doesn't talk to our systems that work with our kindergarten programs and, for example, the kids data. So making sure that the ability for our educators to make sure that they are capturing the information, the child and the family's story coming from pre-kindergarten into kindergarten and beyond is just really, really important.
Yeah, fantastic. And I think, again, speaks to that disconnection that we continue to have across our child service settings. Ms. Oku, I think one of the many things that EverThrive is involved in is trying to advocate on the idea of school-based health centers. I don't think many people even fully understand what that means. And so could you take a moment to just describe those and how they could be sort of used in different ways and maybe some of the impact they could specifically have in our rural communities?
Yeah, so school-based health centers are as the name says, they're health centers that are, housed in different schools, and they provide comprehensive services such as like physical exams, immunizations, they'll do well child visits, behavioral health services, some chronic disease management, things like that. So it provides a wide variety of services. And specifically when we're thinking about rural areas, it can be really beneficial because they often not only see students, but they'll also see their families as well. And so this provides a space for a healthcare point of access for families who might not be able to get to another provider. And, if they're already coming to the school and they have issues with transportation and things like that, this provides kind of like a one-stop, shop for them to be able to access a provider. So we do see a lot of benefit, especially in rural areas, as well as urban areas too. But if there is an access issue, having a school-based health center that can see families as well as students can be really beneficial. about 2 years ago, some of the school-based health centers started offering telehealth services as well. So that can also provide another access point. And so, we'd love to see more of that. But there's definitely a benefit for school-based health centers across the state. And obviously, we really advocate for that. But especially in rural areas where you're seeing issues with access, this can really be a great model for an entire family to receive care and comprehensive care.
And I think so important because of, as we talked about, that anchoring way that a school can be involved, but also just the investment that's needed to make something like this happen. And with the challenges of to make the cost make sense in terms of getting the initial cost to have something like this come up and then also to maintain it. And then having the reimbursement type issues for providers to be able to access school-based health centers. And I think this is, again, another really important time where we're trying to advance telehealth policy. We're trying to engage different ways to make sure that children are addressing their mental and physical health needs. But how do we engage hospital systems? How do we engage providers? And one of the other unique things that are happening right now is a healthcare transformation collaborative, sort of funded by Healthcare and Family Services, to really think about the delivery of care differently. And is this another potential way to use the influx of federal and state funding to really begin building new and innovative ways to deliver care? One of our questions from our attendees was about school nurses. And Dr. Swafford, you mentioned, that more schools are having those opportunities. How can we think about that in terms with some of even the new nursing program that's happening in Southern Illinois, of nurses being embedded in schools, but also this questioner asks, for nurses to give presentations to teachers and parents to enhance kind of group learning around basic medical needs. What are your thoughts on that?
I think those are great ideas. There's something in the chat just to comment about the fact that one of the reasons that the community colleges have dropped their early education is because of the poor salaries provided to those who do childhood education, and not just early, but even into the school systems, and that it was discouraging for people to go into that program. And I think that's very true. I'd say the same is also probably true for school-based nurses. I don't think that they make anywhere near the kind of money that a hospital-based nurse does. And so that has been something that I think probably discourages some from going. I've certainly gone myself into the schools to do teaching. And I think that's something anybody that is in the community as a medical provider, whether that's a nurse or a physician, are typically, at least I hope, willing to do. I think, though, if it's someone who is already in the school, then it's a more immediate access. They're also able to have a little bit of a finger on the pulse of what topics might need to be discussed, rather than when I've gone into the school, it's usually because, this school has a new first-time diabetic, and so everybody's nervous about what's going to happen, or around someone with some specific special needs where we needed to have some education. But there, I think, are a lot of opportunities for that interaction. We have nursing programs in our community colleges, as well as the new program up at SIU that potentially offers people who could come and talk with schools. So I think there's a lot of opportunity for that. And I think, at least my experience has been, that the school is usually very open to having someone come in and help them feel more competent and more educated about how to deal with some of our children. At times, although it's been a while, at the Regional Office of Education when they have their education days. In the past, I've been asked to go and talk, usually about attention deficit or asthma or something that's a fairly common medical problem. So we do have some interactions like that, but it certainly isn't something that we probably do as often as we should.
And I think over the arching theme of, so how do we build those collaborations, connections, and those systems where education, healthcare, social services are really coming together? And, deeper on that and some of those briefs, and you can get a sense of some of the work that's happening led by Dr. Gross with Resilient Southern Illinois and other partners. As we kind of run short, and we had kind of joked about this in our pre-planning, is that there's so much to talk about that this hour would just kind of disappear really quickly. For our panelists, and we're very fortunate to have a lot of people participate today, what's one thing that each of you would kind of leave them with in order to think about building brighter futures for our rural children? Ms. Oku, I'll start with you.
Well, I think, you actually just said what I was thinking, is that, we have to, we really have to look at this as like an ecosystem. We at Everthrive, we're always, thinking about how does the environment around us really support us and our ability to thrive? And so we can't look at these things separately. Health doesn't start when you get to the doctor's office. It starts by where you live and the school that you go to, your food security, housing insecurity, all of that. So we really have to start looking at how they're all connected and working together to make sure that our children are able to live healthy lives. And it requires all of us, connecting and really seeing this as a partnership, and a partnership with parents and families as well.
Perfect. Dr. Swafford?
I would second, especially that last part. I think it's really important as we look at potentially developing some of these community-based groups that can then try to enhance services. We need to be sure we include our families. We as physicians, as educators, we think we know what our children and families need, but sometimes we're not quite right. And so I think when we look at this, it's going to be very important to get that community involvement from our parents and families, and not just from agencies or providers of services.
Dr. James Gross, the final word.
Again, I'm going to echo and completely agree with everything that's been said. But in order to do that, school districts have got to go a step farther and really understand that to build those partnerships and to be in collaboration, the mindset has to be around a whole child approach. I mean, it just does. We have to be able to understand the complexities that are happening in our children's lives outside of school, what that brings, to our school environment, and the fact that that needs to be addressed in almost, in tandem with what we're doing academically, so that students can succeed academically. And so a mind shift or a reset within our school districts, and just really understanding the impact of what it means to really address, whole child needs, et cetera, in building those partnerships.
Well, thank you to all of you, and thanks to also Lori Longville for doing her best to sort of make it to this important webinar. Dr. James Gross, Ms. Oku, Dr. Swafford, thank you for your time, but most importantly, thank you for all of your incredible work across the state, doing all you can to improve the lives of children and their families and to build brighter futures. I hope the participants learned a ton today, but also were motivated about all the action that we all need to do to create better opportunities for our children and families. We hope you join us next month. We're going to dive deeper on challenges with rural health workforce. We are fortunate on that October 14th webinar to have a guest moderator, Goody Kapadia from the U of I Chicago School of Public Health, where we'll be engaging on the challenges around rural workforce, innovative ideas, and how we build the right workforce to address many of the issues you heard today with our children and families, but also for healthcare for all of our populations. So we look forward to seeing you there. Again, thank you for your attendance and your time, and look forward to all of your continued efforts to improve health in our rural communities here in Illinois.
Thank you.